Hi, welcome back to Orthodontics by Dr. Kieran Daly, my YouTube channel. Today we're going to talk about the treatment of underbites or a reverse bite in a teenage patient. Leah presented at 11 and a half years of age in the permanent dentition after all of her baby teeth or deciduous teeth had fallen out. She presented with a significant reverse bite, or sometimes described as an underbite, where her lower front teeth were biting in front of her upper front teeth. This is mostly the result of the underdevelopment of her upper jaw in 3 planes of space, particularly in the transverse or the width of the upper jaw, as well as the length of the upper jaw from back to front. Leah also had a significant overcrowding in the upper arch with no space for the growth or eruption of her upper canine teeth. Leah's treatment started with the use of a hybrid type appliance in the upper arch or in the upper jaw. We use specifically the Easy Driver system, where we plan the placement of 2 very small temporary implants that are very carefully and safely placed about 1 centimeter behind the upper front teeth in the palate. These temporary implants serve initially as an anchor to carry out what we describe as skeletal expansion of the palate or upper jaw. This allows for an increase in the width and volume of the total amount of the upper jaw itself, which provides much more room for the alignment of all of the upper front teeth, as well as allowing for the correction of the reverse bite at the front. Additional to the expansion, once it had been completed, we then started a process of growth modification. This is carried out with a special type of night brace, sometimes described as a face mask. This is worn just in bed at night, and usually it's worn for somewhere between 3 to 6 months. It's very effective at creating a slight acceleration in the upper jaw, which allows the upper front teeth to come in front of the lower front teeth, correcting the underbite or reverse bite at the front. Once the underbite had been corrected, we then fitted Leah's fixed braces or train track braces to start the commencement of the alignment of her teeth. As there was still inadequate space for the full alignment of her upper canine teeth, we then removed her expander and we replaced it with a special type of hybrid appliance called a distalizing device. You can see on the photographs that the distalizing device pushes back on her upper molar teeth, creating room for the growth or eruption of her upper permanent canine teeth. Once these teeth had started to grow or erupt, we then fitted the bracket to allow for connecting these teeth to the upper wire or the upper brace, and then they quickly erupted down into position. At that point, we fitted the lower fixed braces to allow us to align the bottom teeth and create the correct fit of the teeth or bite, known as the correct occlusion. And then once this was completed, we then removed Leah's braces, and now you can see that she has the optimum fit of her teeth and bite. This will allow for the maintenance of long-term dental health and function, in particular the health of both her teeth, her gum tissue and her jaw joints. And you can see there's been a significant improvement in the appearance of her teeth and smile, where her upper front teeth are now visible both when speaking and completely visible when smiling. And overall, there's been a significant improvement in her facial aesthetics.